Right. Welcome, everyone. I'm so glad you all are here today. Let me start by saying something really important. The fact that you're, here tells me everything I need to know about you. You've got a result you weren't happy with. And instead of walking away, you showed up. That matters enormously for people who are now going for their second attempt. Those who are new or were afraid to go for the exam the first time around, you're also welcome here. This webinar is called From Fail to Pass or From Setback to Success. And I want to be direct about something right from the start. A fail in this exam is not a verdict on your ability as a clinician. The MRCEM Intermediate SBA has a pass rate of just 30.9% in 2024. Nearly 7 in 10 candidates did not pass. If you sat alongside those candidates, you are in a very common company. The exam is genuinely hard, and the solution is strategic, not just more studying. So settle in, grab a coffee, and let's turn this result around together. Okay. So what are we planning to discuss today? We are going to briefly go over your score report analysis, the SBA format, and the SLO blueprint. We will discuss the reset timeline planning, and then we'll have a live Q&A to just answer a few of your questions. So here's what we are covering in the next 10, 20 minutes. First, why do SBA candidates fail? And I think the answer will surprise you. Second, the exam format in detail. So we will have a discussion about the exam structure, the SLO blueprint, how marks are distributed. If you don't know where the 180 marks live, you can't target your revision intelligently. Third, how to read your score report by SLO. So if you have given the exam before and you have your SLO breakdown, you should be able to read it and figure out what your weak points are. Okay? So you will use that as a roadmap, not just a disappointment letter. Fourth, the single best answer technique. And I do have another video on this one more in detail about how to actually be able to pick up those clues, how to answer a single best question, what are the options telling you, all those little things that can help you in your exam. Fifth, revision strategies that the evidence says actually work for high stakes clinical exams. And sixth, timeline planning, when to reset, how to structure your preparation. And seventh, your question answers. You ask me anything, genuinely ask me anything, and clear your reservations here and now today. All right. Why candidates fail the SBA? It's not what you think. Let me ask you something. When you got your result, what was your first instinct about why you didn't pass? Think about it, okay? Most candidates think I didn't revise enough, I didn't know enough, and while knowledge always matters, in the vast majority of SBA reset candidates, this is not the primary barrier. The primary barrier is strategy. Look at the number on the screen. The 2024 pass rate was 13.9%, approximately 31%. That's the lowest it's been. But look at it another way. The content of the exam didn't change dramatically from year to year. The curriculum is the same. The SLO blueprint is exactly the same. What changed is how well candidates were able to apply their knowledge under exam conditions to RCEM style questions within the 80-second per question time limit. So let's go through some of the failure patterns that we see. Failure pattern number one, misreading the question. The SBA STEM is carefully engineered qualifiers like most likely, most appropriate, immediate management, and the next step. These are not decorative, they define the answer. So the options might all be correct, okay? You read the options and you're like, we do all of these things, but what they want to know is the answer. So you want to make sure that you don't miss the qualifiers, okay? They will define your answer. A candidate reading quickly under time pressure can miss these words and answers a different question than the one being asked. And this happens far more than candidates realize. You walk out of the exam thinking, oh, I got that question right. That was the easy one, but you didn't read it correctly. And that's why you lost that mark. Okay. Number 2, knowledge without application. So there's a real difference between knowing a fact and applying it to a specific patient scenario. The RCEM SBA always presents a contextualized clinical case. So it's going to be a really long stem. You can have read every guideline, okay, and still struggle to select the single best answer if you haven't practiced applying knowledge to scenarios under time pressure. Number 3, time management. This is a really tricky one because if you try and go faster, you kind of end up in the misreading the question stem. And if you try and go slower, you are in the time mismanagement kind of category. So each paper has 90 questions. That's your target. You have roughly 60 to 80 seconds. And if you spend 3 minutes on a difficult question, you've borrowed time from 3 other questions. And this is a fixable problem, by the way, but only if you practice under real exam conditions. And the last time we did our intermediate boot camp, that's what we tried to fix because we wanted to make sure that this wasn't one of your problem points. Okay, we made sure that you tried to give the exam under exam conditions, and we're doing these MCQs so frequently that your brain was thinking to read between the lines and not misreading the question stem. Okay. Number 4, not using the SLO blueprint. SLO1 carries about 60 questions. Okay, that's a 55 to 60, I would say. Okay, sometimes in the middle. And that's a very big chunk, 31% of your entire exam, roughly. SLO3 is 40 marks. And then together, you kind of have more than half the paper, isn't it? So if you were not targeting your revision to the weightage of the blueprint, you're not preparing efficiently, all right? So what I like to tell candidates is focus on SLO3 and SLO4 first, major chunk, then SLO1. Because SLO1 is a bit too broad and it can exhaust you over time. So if you start with SLO1, you're going to be very tired. SLO3 is a lot more targeted. So start with SLO3, right? Do SLO4 and then move on to SLO1. That's the major chunk again. And if you feel like you're getting tired with these SLOs, switch them up. Switch them up, that's okay. But keep at it, keep going, and focus on the major chunks first instead of focusing on the little topics. I hear many of the candidates go, oh, SLO7 was very difficult. Well, out of the 180 questions, SLO7 cannot go beyond 15. All right, it's not going to be more than that. And yes, you might feel like SLO7 was overpowering in the exam. It wasn't really. And that's only because your brain just remembers the SLO7 questions and it didn't focus on the rest of them. So yeah, it wasn't SLO7 that caused a failure here. You have to remember it is the rest of the SLOs. Right, so key point. Every one of these failure patterns, by the way, is fixable with the right strategy. Okay, now let's discuss the exam format. Let's be absolutely precise about the exam structure. So because I've seen incorrect information circulating online and in revision sources, remember that it is single best answer question, paper 1, paper 2. SLOs are all distributed randomly in the middle. There's no specific SLO being tested. Yes, you might feel like one paper is harder than the other or one is easier than the other, but that's just how you prepared for the exam. They don't have specific questions, harder or less, like easier, simpler questions in one paper and difficult one in the next. It's just a random distribution, okay? Your passing mark is Angoff method decided. So roughly, it used to be between 60 to 65%. Last time, it went up to like 66%. So now I do recommend you to target a score of between like 120 to 125 to be in the safe zone. Last I had a pass mark of 120. So be careful about this one. Was it 120? I remember. Yeah, it was 120. Okay. The SLO distribution. Now let's discuss these in a little bit more detail. All right. Now, this is based on your report card. Is it the report card one? Okay, no. Let's discuss the SLO blueprint first, and then we discuss the blueprint. So this is critical. The exam is mapped to 6 specialty outcomes, all right? And these are updated for your 2021 RCEM emergency medicine curriculum. I want you to remember these numbers by heart. You need to know what this is. SLO1 is a complex, stable patient. So the questions would revolve around a patient who is relatively stable, right? Roughly about 55 to 60 questions come from this SLO. That is a very major chunk, like I said. It will cover a lot of topics. It has medical emergencies and surgical emergencies all grouped together. Then you've got SLO3, which is resuscitation. Fairly simple, I would say, but the questions are really, really tricky. So the trickiest questions are the easiest ones because now they're making sure that you understand the depth of the question. So SLO3 and SLO4 will be fairly easier questions, but tricky, okay? So resuscitation is SLO3. SLO4 is an injured patient. This is mostly major trauma, sedation, orthopedic. So a lot of x-rays and images, image heavy SLO4, right? SLO1 is also going to be image heavy with like CT scans and ECGs. SLO3 also might have a lot of ECGs, but SLO4 is majority image heavy. SLO5 is pediatric, and pediatrics is fairly simple in MRCEM. It gets complex in FRCEM, but for MRCEM, fairly simple, know your basics. SLO6 is procedures, and this is roughly 20 questions. This will include your advanced airway, your chest drains, pacing, POCUS, IO access, fracture manipulation, LPs, wound management, things like that. And then SLO7 is complex and challenging situations, which involves your legislations, organ donation, information governance, safeguarding. And this carries roughly 10 questions, but yeah, it can go up to between like 10 to 15, but that's the extent of it, okay? Now let's go through your report card. If you've given this exam before and you have your breakdown, let's discuss it. I want you to get your score report out. If you have it with you, open it now. Your RCEM score report gives you a breakdown of your performance by SLO, okay? This is a roadmap. Many candidates look at the overall score, feel the sting, and then put the report away. Now, let's use it properly, okay? Let me teach you how to analyze your own score report and build your own strategy to ace this exam. Step 1, go to your SLO breakdown, all right? It's going to be below 60%. Go through each SLO in your report, highlight every SLO where your score was less than 60%, because you are targeting a 60-65% in each SLO. That's your target, okay? Now, go through it. These are your priority targets, not the topics you find interesting. The ones where the data says you underperformed is where you're going to focus. If you're going for this exam first time, right, you don't have this. It doesn't apply to you. Then you should apply the general rule where you will follow, where the majority of the marks are, okay? But if you're a repeater and you're going for this exam again, take your SLO breakdown out, focus on that SLO where you scored the least, okay? Less than 60%, that's the SLO I want you to focus on, and then build your concepts. And you do this before you apply for the exam. That is the time when you build your concepts. Step 2 is weight your effort to the blueprint. So here's what most candidates make a critical mistake about. They treat all weak areas as equally important. They're not. A 10% improvement in SLO1, which carries the maximum marks, is worth 5 times more to your final score than a 10% improvement in SLO7, okay? Which is just 10 marks. So your revision time is finite. You don't have all day, you don't have many, many months. So allocate it proportionally to the blueprint weightage. Okay. Step 3, map weak SLOs to the clinical syllabus. So download the blueprint. Okay, you can go to the RCEM website and download it, or I have shared the blueprint in the drive that I usually hand out for free in the intermediate group. Like I've sent a lot of material there. It's uploaded in that drive. Have a look at it. You will see the information pack. Each SLO lists its exact clinical category. So it has those topics listed underneath it, like what should you focus on? And if, for example, SLO1 is your weakness, right? Look at which of its 25 categories are most likely to be your gaps, okay? If SLO5 is weak, you're looking at pediatric emergency medicine, neonatal emergencies, and pediatric safeguarding. So see which is weakest for you, and only you can identify this, by the way. Do it for yourself. Step 4, understand your pass mark, all right? The pass mark is norm referenced and set after each setting. So you will never know it in advance, but based on historic settings, it ranges from approximately, I have written here 1117 because it's an old one. The recent one was 120. So I would recommend having this between the pass mark. Like the pass mark can be between 1115 to 120. Okay, that's the pass mark. So you're aiming for above a 65%, and to be on the very, very safe side, aim for a 70% in this exam, please, if you want to make sure that you pass in the first go. Okay. Step 5, build a blueprint-driven, non-comfort-driven plan, not a comfort-driven plan. So revise the weakest SLO first, weighting them to their mark allocation, maintain your stronger SLOs, but do not over-invest time there. Blueprint-driven revision is the most efficient path to pass this exam. Another tip is, if you can't find the blueprint, I'm gonna, save it and send it again, or just save the drive and send the drive link again. And if you're still having trouble with like reading your own school report, what we're going to do for all of you attending the webinar, just drop us an email or send us a message with your report card, and I will give you a reading for your school report for free, just to have, so that you understand like where are you going wrong and you understand your problem, your weak areas, and then you can focus on those. Okay. Now let's look at the answering techniques. So this will apply to every question, all right? This is the most practical, I would say practically actionable section of today's session. Please, I want you to apply this framework to every single SBA question from now on. Not most questions, every question, okay? Oh, by the way, sorry, if you have any questions in the middle of the session, just please leave them in the chat box and I will read them in between slides and answer them along the way. We do have a Q&A session in the end, so if you want to ask away, then it's up to you. Okay, all right. So question 1, read the lead-in question first. What does that mean? Before you read the clinical scenario, read the final question line, like the last line, all right? What is the most appropriate immediate management? Tells you to think resuscitation and stabilization first. What is the most likely diagnosis? Tells you to think about the differentials. Knowing the question before you read the case stops you from going down the wrong clinical pathway in your head. Okay. Step 2, extract the clinical context. As you read the STEM, actively pull out age, sex, vital signs, time course of the symptoms, clinical settings. These are not decoration pieces in your clinical scenario. A 26-year-old with pleuritic chest pain and a positive D-dimer is a different question from a 68-year-old smoker with the same symptoms. Okay? Context will define your SBA. Number 3, you want to identify the qualifier. So find the qualifier word in the question. Most likely. Look for the most common diagnosis matching the pattern. Most appropriate immediate management, think ABC, resuscitation, stabilize first. Next investigation. You have already done the history and examination. What single test comes now? Most appropriate management versus most appropriate initial management. These are different questions. Read every word. Okay, with me so far? Right. Step 4 is eliminate, don't just select. Okay, rule out the other options as well. Don't just look for the one that you think is the answer. Try and make sure that the others are not the answer. So look at all the 5 options. Sorry about that. First job, eliminate clearly wrong ones. Cross them out. Strike out anything contraindicated in this patient. Anything clearly outside the scope of this question. Anything obviously inappropriate. In a well-written SBA, this gets you down to 2 options. Then you make a focused decision between the 2, not a random choice between 5. And this you will apply to all questions, especially the ones where you absolutely don't know the answer. Try and apply it to them as well to make an educated guess. And there's a 50-50 chance you might get those right too. Okay. 5, apply the RCEM guideline lens. So when you're genuinely stuck between 2 options, ask, what does the relevant guidelines say? Think BTS for respiratory, NICE guidelines for general management, RCEM guidelines for cardiac arrest, BOST for orthopedic emergencies, RCOG guidelines for obstetric emergencies. So RCEM will prefer guideline answers, like guideline-based answers. So not to what you do in your department, but what would you do according to the guideline. So it doesn't matter what you do. It doesn't matter what your consultant does. What matters is what RCEM considers a standard. That's what you need to answer. Okay. Now, a quick practice tip for all of you who are actually going for the exam and have given the exam before. This won't apply much to you if you are going for the first time. But if you have given it before, you are a bit more prepared. Take 15 questions from the question bank like you were doing before. Apply these 5 steps to those questions and see how you do with your score. Yes, you will be slower the first few times. You won't do the 15 questions in 15 minutes. That's okay. But with practice, you'll get there. Try this and see if your score improves or your understanding of the question improves. Okay, that's just a quick tip for all of you. Right, evidence-based strategies. Now, let's go through these one by one. So let's talk about how we are going to revise, because the syllabus is very broad. And by the time you get to the exam, you don't know how to summarize everything and collect everything up, right? And you can waste a lot of time doing, this kind of thing where you have to read the book again, go through the recalls again. It's just too much. So active recall, that's the most effective method. You can make your own notes, and I'm going to give you a bit of a quick tip here. It is a bit geeky, a bit tech savvy. If you're not tech savvy, learn it. There's a good, efficient app, not an app, it's an AI tool known as Notebook LM. I give this advice to anybody. I recently did my primary webinar and I told them to use it as well. Please use it. Put your resources there and play around with it and study with it and see how you do. Okay, Notebook LM is a good way to study on your own and revise. It has a good flashcard system. It can help you revise a topic. Okay. And if you need more information about it, just give me a message about how to use it. Right. Spaced repetition. So mass practice, cramming produces like short-term performances. You'll remember it short-term, but long-term, you're going to forget it. So keep revising that material over and over again at different intervals, right? Do something for a short interval, leave it, come back to it again after a little while and see how you remember it. And this will produce durable long-term retention, right? Then is timed practice under exam condition. This is where you can do your mocks. If you have subscribed to any question banks, do their mocks often. Don't exhaust yourself, but do try to do their timed mocks as much as you can. When we did our boot camp, we tried to make them do it as often as possible. We did SLOIs and then we did full mocks, and we tried to make them get used to the timed practice. Okay, the more you do it, the better you get. Recommended resources. Please use recommended resources, and my #1 recommended resource is and always will be RCEM Learning. All right, this is the official resource that RCEM suggests. So please use that along with recess guidelines. So that's your recess UK, SLO3, all from recess UK guidelines. Okay, SLO1 to SLO7, all of it from RCEM Learning. Images, X-rays. For X-rays, you will find good amount of X-rays and CT scans for ortho and everything else on RCEM Learning. But if you need something extra, I would recommend ortho bullets. And for ECGs, it's life in the fast lane. Okay, always prioritize RCEM sample questions above other banks because they are very much more accurate than the rest. Okay, for your exam. All right, any questions so far? I hope I'm not going too fast for all of you. Happy? If you want me to repeat something, just let me know. This is an interactive kind of webinar, that's why we're doing it live. So ask away. Do we have any questions? Okay. All right, let's proceed. So when should you reset? Now this will be highly personalized, okay? One answer will not fit to everybody's liking. It's up to you how you want to do it. Now, technically, MRCEM SBA runs twice a year. So you don't have a lot of flexibility in how often you can reset the exam because you kind of end up losing a year almost. And since OSCE is a long wait, you lose another year for the OSCE, and then you're looking at a 3-year gap between primary, intermediate, and then OSCE. So this is, even though it is variable, I do not recommend people to delay their reset. However, having said that, I would again like to repeat myself, not everybody has the same circumstances. So if you want to make sure that your reset is a successful one, change your circumstances first before you go for the reset. Otherwise, it's going to be a bit difficult, okay? The answer will depend on how far below the pass mark you were, and we'll cover it. But before we get to that, check your examination calendar, see if the timelines work for you, and if not, then you want to be careful about how you can go about doing that, okay? So if you were less than 5 marks below your pass mark, right, you need 8 to 10 weeks of targeted SLO revision because you were close. You just need to refine your technique, not everything else. But if you were between the 5 to 15 marks below, then you're looking at a 10 to 14 weeks, right? Structured, full blueprint revision with daily timed question practice. That's what you're looking at. And also, you have to cover every SLO. You don't just get to target an SLO, you have to do it SLOS. And if it's more than 15 marks below the pass mark, you need one-on-one support. Because I feel like if somebody is below 15 marks, they don't have, not only do they not understand the curriculum, they also don't have the concepts, or their basics are a bit too weak to build concepts on. So they need a lot more help. Okay. Now let's go through the week. So week 1 to 2 is recovery and analysis. So after you got your result, rest, recover, get your score report, identify your weak SLOs, and check your next exam date. Okay. Week 3 to 8, start focused revision. Now here, you are doing active recall. You are focusing on your weakest SLOs first. You are also going to start your question banks if you are subscribed to any question bank. I would suggest you go through them, okay, at this point. Then it's week 9 to 10. Sorry, is there a question? Oh, okay. Now, week 9 to 10 is when you consolidate those week questions. Now you're moving into the, I would say, the mock exam territory. And then the last week is when you're just revising everything, okay? You're bringing everything in together, revising it, still focusing on resting and confidence building because you've given the exam before, but you're still worried, but you're doing the best you can, all right? Now, remember, the RCEM examination calendar is published in advance, but the window to apply for the exam is short. It's just 7 days. So sign up for your email reminders. Okay. If you are worried that you might forget, like when it opens, just sign up, go to RCEM, email reminders, and then they will email you once the next date opens. Okay. So that you know when to apply. All right. Mindset and motivation. Sorry. All right. So this is almost, we're reaching to the end. If you have stuck around this far, thank you. I want to take 2 minutes here, not for content, but for something more important. You are a doctor, you have passed medical school, foundation years, core training, you have been in emergency departments looking after real patients in the most acute moments of their lives. This exam is hard, it is designed to discriminate, and you hit a setback. But here is what I know. The 31% who passed the 2024 MRCEM exam or 2025 MRCEM exam were not all smarter than the 69% who didn't. They were more strategic. Many of them had sat it before. Many of them sat in a session like this one between their sittings. Failing is data, not destiny. Okay. Every strategy you've heard today is actionable this week. The SLO blueprint is available on their website. Your score report is waiting for you. The question banks are all there. The resources, everything is there in your hand. The gap between where you are and where you need to be is very much bridgeable with method, not magic. So this reset is not your last chapter, it's your strongest one. Now, what you need to do is a clear SLO-driven strategy. Please have a realistic, committed timeline, grab a pen and paper, write it down for yourself. Honestly, use your score report. Don't just look at the fluff, look at the SLOs, look at the real stuff. Get the right resource and the right resources. Believe that you can and you will pass. And just know we're all here to help you get there. Okay? All right. So ask away however we can help. These are the key resources that we recommend. If you don't have any other resource or you don't want to go for a course or whatever, these are the resources I recommend. Now, I have a few questions that some of the candidates have asked that we've asked them to share that we can go over. But before that, just quickly, I'm going to check in if you have any questions. All right. Thank you all for listening. If you have any questions, ask away. If not, we'll go through some of the common questions that are very frequently asked. Okay. No questions. Was I that boring? Or were you able to understand absolutely everything I was saying? What about Alameen for SBA? I have heard some good things, some not good things. The thing is, I don't have any problem with any of these courses, okay, because they do help people out. My problem with them is the number of candidates they have. So Alameen and many others, they have a lot of candidates, like 100, 200 people. And so their approach is generic, not targeted. So not everybody learns the same way. There could be somebody who struggles learning with their pace, and that person would fail with Alameen. But the 70% that attend his course could pass. Now, among those 70 people, there could be those that have given this exam like twice or maybe once before. There could be people who are not working, who have a lot more time to actually give and study. So not everybody's circumstances applies to it, but that course is generic and it works. And that's my problem with many of these courses. It's up to you. If you align with how they teach, if that person can help you understand the concepts, why not? Go for it. If not, Don't just follow it because your colleague said so. Do your own research, attend their free lectures and see, do you like it or not? The other hot tip I have, especially with SBA, is attend every course's free lecture. Why not? Just, they are free. Attend every course's free lecture and then see which one you align with, which is more suited to how you learn, and then pick that one. Okay? Don't just randomly go to a course just because it helped somebody else, because everybody learns differently. I hope that answered the question. All right, let's go through the questions that you guys sent me in. Let me just see. How do I know if I'm ready to resit? Good question. You are ready when you are consistently scoring 65 to 70% on your timed question banks. Now, having said that, if you already know the answer to the question banks, like success ones are too easy, exam prep, expert, I don't recommend success, by the way, but like exam prep, expert, if you're scoring consistently above 65 to 70% with understanding of the question, I would say you are ready. That's it. Should I change my question bank? Not necessarily. If you use the question bank but did not thoroughly review your wrong answers, the problem was the method, not the question bank. However, if you have exhausted all the questions in one bank and now you're finding them too easy and you're not using your brain anymore, a second bank will provide some fresh scenarios. RCEM's own sample questions are really good, and their own SBAs on the website are also really good. So you can, try out those as well. And if you're already an RCEM member, you get access to RCEM Learning for free. How many questions per day is enough? In a focused revision phase, I would say 30 to 40 questions per day should be enough. And you review every single wrong answer in like detail. You study the topic, you review it, like, why did I get it wrong? So quality of the review is more important than the volume of questions. Is 8 to 10 weeks enough? Well, like I said, it depends on how you were scoring. If this is your first time going for the exam and you have a good baseline, I would say so, but you need to be consistent and keep studying. And depending on your score, like I told you before, 8 to 10 weeks is good if it's between the range of 5 to 10 marks. Sitting too soon and failing again will cost you one of your 6 permitted attempts without meaningful improvement. So that is a significant setback. Be careful. What does borderline mean on my score report? They don't use borderline anymore, but basically you failed by not a lot. You were in the borderline, I would say. That's what it is. How do I improve my SLO1 score? It's my weakest. Well, SLO1 is, I agree, it is the biggest SLO. It has 25 topics and they're really vast and wide, so much information. So the first read I would say is go through Oxford Handbook, but update it because Oxford Handbook has old guidelines. The second way you can do it is just go to RCEM Learning. Go through all the SLO1 topics through RCEM Learning, and that should be enough, I would say. How do I stay motivated when studying alone? One, use Notebook LM. It is amazing. Amazing tool to study on your own. It keeps you motivated. Break your revision into blocks. Target specific topics. Like today, I'm going to do this, and then don't get distracted. Just do that. Write down your topics and then follow through. And have realistic goals. Like don't write down a very big topic and expect yourself to do it within a day or two. Be realistic with how much time you want to allocate to a certain topic. All right, these were all the questions that I had. Thank you again for listening. And before we close, just want to let you know, very proud of everybody who joined today. Your journey to MRCEM isn't easy. The workload of being a clinician in the emergency department is already immense. I know you're working jobs, and then the exam stress on top of it is just good God. So it does take real commitment and real courage. All right. You came here because you didn't give up. And I'm glad you did. Okay. If you need any more information, any more help, you have our socials, you know where to contact. You have our emails, you know where to find us on Facebook, Instagram, YouTube, anywhere. Just ask away. We're just a message away. All right. And I will see you all in the next webinar, whenever that is. And if not, you might see me around in any other videos.